I'm at the Pocono Medical Center here in East Stroudsburg for the return of Dr. Nche Zama here to the heart program at the hospital. Dr. Zama, welcome back.
I am very glad to be back.
You led the start of the cardiac surgery program at Pocono back in 2007. A lot has changed, I'm sure.
Yes, a lot has changed in many ways. We started the program, it seems like just yesterday, and we went through some very challenging times, but the team, the hospital, everybody worked hard to take the program here to the highest levels of accolade nationally, and I'm very glad to be back.
Now, you were in Philadelphia for 3 years. What brings you back to Pocono?
Well, I just miss Pocono because Pocono to me is home. And no matter where I went and traveled, not just working in Philadelphia, I always felt home to me was the Poconos. So I'm glad to be back home.
Consumer Reports named you one of the top 25 surgeons. How does that make you feel?
We all like to receive recognition for the work that we do, but my primary focus has never really been about recognition. It's about being sure that every patient that I see will get the best possible care and that I will provide the care that is truly second to none. And every patient to me has always been and always will be special. So in a way, yes, I appreciate the fact that that recognition was good, but it's also important to remember that most of us are always cognizant of the pilots, and very few people think about the ground crew. There are a lot of people who work hard to make a successful flight possible. There were a lot of people who work hard to make sure that we have a successful heart program, and they deserve recognition as well.
Besides your practice, you also go on missions around the world.
Yes, I've always enjoyed medical humanitarianism. I've written about it and I've done it. And just recently, actually, I spent the past 4 weeks in a refugee camp in Africa and helping provide clinical care as well as emotional support to so many of the unfortunates who are refugees in the camp. And I've traveled the world doing open heart surgery for free and providing general medical care. There's times when I deliver babies and vaccinate children. I just believe in giving back to the community and to the global community, the world community, and appreciation for many of the good things that have happened to me in my life.
What do you see as the future for the heart surgery here at Pocono?
We have a wonderful team here in Pocono Medical Center. There's a lot of new technology and a lot of new clinical medical knowledge and advances in cardiovascular care and the management, surgical management of cardiovascular disease. There's so much that I have learned personally during my stint in Philadelphia and my travels around the world. And so much of that novel technology, I look forward to applying that here with my team to ratchet up the care, the level of care that we provide patients in this region and truly make it second to none in the world.
Now let's hear from some of the people who have benefited from Dr. Zama's skills.
Oh, I'm glad Dr. Nche Zama's back. He's the best thing that's ever happened to this area. I'm looking forward to another 71 years. I'm 71 years old, and my wife was cured of cancer over here in the cancer center, and we're doing good. We're the success stories for Pocono Medical Center.
Dr. Zama is the man. He's the man that will take care of you. He's the best around. Bedside manner is so great. And he actually held me out of the operation for 15 minutes till my daughter got there because she was taking finals at Stroudsburg High School. And he wanted to make sure that I saw my daughter before I went for my operation, and she got to see her dad.
Yeah, this is a great opportunity for us to have Dr. Zama come back into our community and do what he has done before. He's had over 1,000 surgeries here since he was here last, and we're looking forward to him to service our community as he did in the past.
If people want more information about the ESSA Heart and Vascular Institute, what should they do?
Oh, just call the hospital. And if they have any questions, any concerns about their cardiac care, we're always there to serve them. We're here for the community.
I'm so glad you're back.
I'm glad to be back, yes. My pleasure.